Hello, everyone. Welcome again. During today, we spoke a lot about the need for collaboration and need for systemic approach to handle the crisis in healthcare and helping it with data and digital services. And one of the initiatives that supports this is the Global Health Connector Partnership. And this is the session now. What is the Global Health Connector Partnership and how it can support the recovery of the health systems globally? This session will be hosted and moderated by my colleague, Heather Smith. Heather is the Operation Director at the ECHAlliance group, and she's the person who always takes care for all the different initiatives when they're born as ideas to make sure that they're implemented. And she was with the Global Health Connector Partnership from the start. So I cannot think about a better person to introduce you to this panel and host this session. Heather, the floor is yours.
Thank you very much, Carolina. So as Carolina mentioned, the Global Health Connector Partnership was initiated by ECHAlliance in 2020. It was as a result of the COVID pandemic, and it works with a range of partners working to make healthcare global and sustainable. I'm going to introduce three speakers. The first one is Brian O'Connor, Chair of the ECHAlliance and founder of the Global Health Connector Partnership. He currently provides strategic advice to governments, international organisations and companies on the challenges facing healthcare and in general, and specifically on connected health opportunities. He is a chair of a number of innovative companies and an investor in startups. Our other speakers are Professor Rajendra Gupta. He is the founder of Health Parliament India. Professor Gupta is a public policy expert who has been contributing to policy making for over a decade. He has been invited to work with some of the largest organisations across the world, like the United Nations, UNESCO, World Bank, World Health Organization, World Economic Forum, and the Government of India for his views. Our final speaker will be Dr. Amit Thakker. He is the president of Africa Health Federation. A visionary entrepreneur and industry captain, Dr. Amit Thakker has been a groundbreaking pioneer in the integration of private sector within the healthcare systems in Africa. Dr. Thakker actively supports governments, corporates, health organisations and development partners to foster effective public partnerships towards improved health outcomes. He is the executive chairman of Africa Health Business, president of Africa Health Federation, and the immediate past chairman of Kenya Healthcare Federation. So I'll introduce Brian.
Thanks very much indeed, Heather. It's great to see everyone here, and I know there's a lot of people watching and listening, so we've got to be on our best behaviour. So our first slide is, and pick up from what Heather said, this was formed during the beginning of March 2020, I think it was, of the global pandemic. None of us had any idea what scale that would take, and we're all disappointed when it became a real global pandemic. Whenever there's a crisis, you often, I don't know about the rest of you, but I often think to myself, so what? What can I do about it? And in most cases, we shrug our shoulders, say, isn't it terrible? But we don't really do anything. So I decided, as I was not able to travel during that time, I had to do something. So I started to call people I've known in many cases for many, many years who run organizations in their own continent similar to that which we run in the ECHAlliance. So as you can see, we have assembled a group of like-minded organizations who are determined to connect global health communities. And I think on the next slide, you'll see that we have brought together a group of people, some of the faces you'll recognize, obviously Raj and Amit here with us today, but also people from the Commonwealth with Vajira and from American Telemedicine Association. You know, when you look at Martin Curley, for example, from the Shift Left, Stay Left movement, as he likes to call it these days, and we have Rich Scarfo from Health. This was not an accident. This was thought through. When we first had our first meeting, which was limited to 1 hour, I asked the question, so what, after the 30 minutes of introductions? Do we want to work together? If we do, what are we going to do? So as you'll see in the next slide, we have made significant progress over the last 2 years or so. we decided that we had to be relevant. We had to actually pick some specific topics where together we have some expertise, some influence, and a determination to make a difference. So far we've selected 4 key themes. The disparities theme. This is something which we all know exists. In fact, my view is in many ways, because of the global situation, not only the pandemic, but the cost of living crisis, etc., disparities are in fact expanding and getting worse globally. Then we moved on to the data and digital services, which is the key of this Digital Health Society Summit. And that, of course, as you've heard from many speakers and will later today, is just something which is fundamental to changing the world. Then we moved on to the digital skills, which everyone agrees again, that this is fundamental to changing the world. We then moved on to more recently green health. And just to be clear on this one, green health to us is not about blaming everybody else for the climate crisis, not about saying, isn't it terrible, but what can we do about it? You know, we will use electric cars, we'll do all of that, all of which is good. But actually we start to look at our own industry, our own sector. And in some parts of the world, would you believe that the airline industry only produces half of the emissions that we do as a sector? So we can't say it's someone else's problem. It's our problem. So these are all fundamental. But again, we didn't shrug our shoulders. We have now formed, as you'll see in the next slide, a way of actually doing something about that. So we've created an infrastructure of what we call flagship events. We're doing these in conjunction with each of our partners. We're doing that across Europe, across the US. We're going to India at the end of October. And I'm going to Africa to work with Amit towards the end of November. It is fundamentally important that not only do you decide who you are, what you're going to do, but you have to have a means of doing it. So we have created this infrastructure where the topics that I've just outlined will be talked about at each of the events you see in front of you. So what does all that mean? It means that I'm absolutely delighted to have with us today 2 of our partners who have been really active over the last couple of years with us. I hope will be for a very much longer time. And so it is really honestly an honor and a pleasure. And people say that when they introduce people and you hear it all too often, you wonder, is it really an honor and a pleasure? I can honestly tell you it really is. So I'm passing on first to Professor Rajendra Gupta, who's become a great friend as well as a colleague and a partner. Over to you, Raj.
Thank you, Brian, and thank you, Heather, and the entire team of the Global Health Connect Partnership. And I firstly feel very privileged, to be on this platform. And as Brian said, that he ideated that during the crisis when it was starting. March was actually the start of the global pandemic, the way it took off in terms of growing exponentially. What it says is, the futurist in Brian who could think, that it's not going to be short-lived, we're going to live with COVID. I really appreciate the thinking that he had, and what he created is amazing. And I say this with experience, I have a chance to work with all global bodies, whether it's HIMSS, it's World Economic Forum, it is UN, it is WHO. But what he has built is not just a platform, it's an action network. During Ukraine, what Brian has done for them, he speaks less about the work he has accomplished. Today, if we are hosting the summit in India, end of the month, it's a push because of the network. The network had events and said, would you want to host something in India? I think I would owe it to Brian that we, got, really inspired and said we should do something big. So for us, that also became, one of the biggest beneficiaries of being a part of the Global Health Connector Partnership. I would also say that we benefit immensely out of this partnership. ATA is an event where I have been a part of for a long time, maybe a decade and a half. As a Global Health Connector Partnership, we started ATA main stage, the Global Health Connector Partnership, even with there, we all got to talk about our countries, what progress we made. We also learned, and this is thanks to the partnership that, we made this happen. We are working on a session together at the Global Digital Health Week, around 12th of October. And this gives us a lot of I would say a strength, a network, and we can fall back on. I would owe, and I have no hesitation to confess or not to admit at this gathering of 900 people that some of the brilliant people whom I would have hesitated to meet or interact, thanks to Brian's network, I was able to talk to them, get them to be speaking, get them to be learning from their experience, which is so amazing. Today the power lies in getting those networks in place, and what Brian has come and created is an amazing, unparalleled network, I would say. And now I want to take maybe a few minutes to walk you through what we have created. Hita, can I share the screen? So one of the things we do is, when we are with such people, that we need to create value for the world. These platforms should not be used just for us to be talking about ourselves. So this is what is something that I'm championing through the network and seeking your support and views. And I owe it again to the brilliant team of the Global Health Connect Partnership and the leadership of Brian. And I'll give you the thinking behind this. In 1978, we had the Alma Ata Declaration, which said health for all, basically focusing on primary care. And in 2028, which is exactly 6 years from now, we would achieve 50 years of Alma Ata. But it is so shocking and inhuman that we have not been able to assure health for all even 50 years after this declaration, when we had promised them 22 years ago by 2000. So one of the things that I have been championing and have got enormous support from the entire network, Brian, and thanks for that. I also spoke with Dr. Tedros, the WHO Secretary General, that at least let's work to ensure digital health for all. That's the least we should do. Today, we are, as a part of the global network, joining from Africa, US, UK, Europe, India. Every part of the world is connected on the Global Health Connector Partnership. If we come together as a force, and what Brian has made possible is the overarching theme that I see is reglobalization, and reglobalization by a purpose, throughout the Global Health Connector Partnership. So can we work together, to have this digital health for all with such amazing champions representing the regions, of making sure that when we touch 50 years of Alma Ata, which I guess will be November of 2028, then we should have ensured that 8 billion people have access to digital health services, if not face-to-face access to a doctor. And in the age of 5G that we are all doing, we could make it happen. And I see, as European, the ECHAlliance, Global Health Connector Partnership, Health, Digital Health Society, Africa Health Federation, and all partners, if we get together, I think we will do it. I'm quite optimistic about that. And I think it has been no less than a divine intervention to be a part of the Global Health Connector Partnership. So much learned. I don't know if I shared so much, but I gained so much. I mean, it's been a one-way traffic. I've been like gaining every time I get on a call. And the best part, very professionally managed. And I owe my thanks to Hither and Beatrice for their continuous support. Whenever we needed something, they have been available. Brian have been available. So I think this network, to me, is the most valued network, I would think, on digital health. And if we have such a brilliant network, we have no reasons to, sitting on our butts and saying, if we have the network, we're very happy with it. No, we got to make a difference. And under leadership of Brian, I'm pretty optimistic that we'll work together to have digital health for all by 2028. Thank you so much.
Thank you very much indeed, Raj. I'm delighted to introduce Dr. Amit Thakker. Now, I just want to say this. I've never actually met Amit, as is the case in the last 3 years. There are lots of people you feel you know, but I've never actually met. So I've decided to go to his hometown of Nairobi at the end of November to meet up with him and his team and to participate with him in a Global Health Connector session there. So Amit, I'm delighted. I'm looking forward to meeting you, and I am delighted to welcome you, and please let's have your remarks.
Thank you, and you're all welcome. Anyone who wants to come can join Brian, but like Raj has mentioned, it's been a great and a valuable network, and met so many clever people and great people and dedicated people in making a world a better place. Brian is one such person who spends time in making really the world a better place with the skills he has with his team. And 2020 was when ECHA initiated this. So I want to just reflect on 2 points in the time that I have. One is my thinking about GHCP, And the second part is why Africa is playing an important role, the 2 points. So let me jump into my thinking, what I see, what Brian and the team have started will evolve into. The first point is every crisis leads to an opportunity. And this crisis actually led to an opportunity. It triggered off something that the world was looking for, global health was looking for. And I think collaboration is the new innovation. And through that, we realized that we're beginning to save lots of lives, lots of ways in which we do health systems in a different way. And that innovation is done effectively through the power of partnership. The power of partnership is meant to model a stronger health system to deal with challenges and problems in several continents around the world to improve life expectancy and health of people across all regions. Africa Health Business, which is the company that I run, which is headquartered in Nairobi, where Brian is going to come and join us in a partnership forum, is delighted to be a partner. And I'm really happy to be a council member. And all of us give our own time to make sure that this connectivity and this platform actually becomes an action platform that produces results beyond, of course, creating discussions and talks. So I am really happy that we are part of this. I'm also really happy that we've got 4 committees that were designed as literally active committees, which Brian showed us and talked about. And I am beginning to feel that regional leads might be the next step. Why regional leads? Because each region has a different weighted index in all the 4 divisions. What might be very important to Africa right now might be very different for what's important to America, and might be different for what's happening in Australia. So regional leads and continental leads will make the power of partnership of GHCP reach to the next level. Within the regional leads, the responsibilities will be now focused on 1.3 billion people or 1.5 billion people, whatever the case may be. In Africa, it's the 1.3 billion people. And what we can do with the 1.3 billion people and the knowledge that we gain in all the 4 committees may be different on who we will engage, which governments we will engage, and which partners we will engage. So the Action Platform Africa about GHCP will focus on priority along the 4 committees, and it will start building strategic partnerships amongst the 3 main models and buckets to which GHCP can get results. There are only 3. And these 3, the first one is government. And with the government, the pool of engagement will drive different priority agendas and policies. I'll give you examples. In Africa, it'll be like Africa Union, Africa CDC, WHO Afro, so on and so forth. The second pool of partners or strategic partners is development partners. They play a big role. USAID and many others are continuing to supplement huge amounts of budgets and many amounts of initiatives around digital health in many countries in Africa. USAID is one example, but you can go to GIZ and talk about many other partners who continuously are impacting. And through that, I think we can leverage what we call our second bucket of partners. And the third bucket of partners will play a sustainable role for what we're doing. It's called the private sector. And this are corporates, organizations, institutions, NGOs. These are all non-state actors that play a role in healthcare. Like in Africa, they produce half the healthcare that's being provided to the 1.3 billion people, which may be different from what happens in Europe. See, in 50-50 is where the African continent currently stands. I just wanted to share that as my thinking of GHP, and I'm looking forward for the council and the partners evolving into something that might be amazing when we come 10 years later and talk about where we are. I want to talk a little bit about Africa. Why Africa? My second point is that the impact that the connector partnership will make in Africa might be quite significant. If they always ask you, you've heard of this saying, low-hanging fruit. Where can you start making a big impact with small things? And a continent like Africa is where I believe is a low-hanging fruit. There are two reasons why we have challenges in the health sector and the life expectancy is so low, where a baby girl in Sierra Leone lives for 42 years, but a baby girl in Switzerland has a life expectancy of 84. And the difference is mainly of two barriers. One is geographical barrier and the other is financial barrier. This partnership isn't putting money into the systems or driving funds. It may allow savings in healthcare systems so that it can produce more health. But I think the big area this partnership can deal with is the geographical barrier. The geographical barrier has created a huge dent in the life expectancy and overall health of the people on the continent. And with some very innovative and clever solutions that the Global Health Connector Partnership may provide, the adoption by many ministries of health and many stakeholder leaders is really at its highest after the pandemic. So if we can quickly start having telehealth, e-learning, telepathology, electronic medical records, electronic solutions, all these will continue to provide a huge amount of solutions under the geographical barrier and strengthening health systems. So I want to say that Africa plays a certain big role. I'm looking forward to meeting Brian. I'm hoping that we can talk about this when we meet many of the African leaders that you'll engage with when you're here in Nairobi, and we can unfold what lessons we may learn together and bring it back to the council that will steer the activities and action in Africa. Thank you so much. I hand it back to you.
Thank you. Thank you, Amit. We've had one question, and I put it to you all. You can decide who would like to answer it. Why have the Global Health Connector Partnership when we have the UN, WHO, etc.? Aren't they doing the same work?
If I may chip
Fine,
in.
you're on mute.
Raj, that's the first time I've managed to do that in Zoom call. So thank you very much indeed, Heather. Right, Raj, over to you. Why don't you answer first, then we'll come to Amit.
Yeah. So I think, pardon me for using the words, there are some fancy organizations. They have a legacy, they have a history, and they have a framework. They're very tightly knit. There's a difference between how those multilateral bodies or the old organizations operate and how this operates. It's very loosely knit. I mean, if you ask me, is it a formal? No. Do we work formally? Of course, yes. We have 4 themes. We work on that. Is there flexibility? Absolutely. So this is a new age organization which is in tune with what people want to do. You don't want that bureaucratic approvals, to wait for decades. And I would insist that those who want to understand, the Global Health Connector Partnership attend to the 1-hour call. It's exactly 1 hour. Everyone speaks, there is an agenda that's discussed and there's an action. So I would say this is the most professional organization I that I know of. And amount of work it's done to push the agenda for digital health, less said the better. You don't get to be, on the main stage of oldest organization like ATA, which is completing 35 years next year. So I think this is a new age organization which has values, which has clarity of goals. It gives me the flexibility, and I'm not forced to do things that is your agenda. I put my agenda and Brian says, hey, good to go. The council will approve. This is the beauty of the organization. I don't think that there is a comparison or there is a need to compare to say why this and that. I think everyone has a space to exist as long as you do path-breaking work. And I feel that this organization has been doing that. WHO will continue to be convener for the governments. They will. We will probably look at innovative stuff. bring those agendas. Governments may adopt, may not adopt, but our work will continue. Like Amit very rightly said, he leads a large continent which has to move from its image of being a dark continent, and platforms like this give an opportunity. So I think for my country, I see a great organization like this. We learn. When I'm getting Brian and his wonderful networks to India, one of the things we're going to do is make them meet the National Health Authority team. Which organization will give you that? Can I write to WHO and say, get me the world leaders? I want them to meet the country's top policymakers? Absolutely not. Probably they will say, no, let the government request. I don't have to do that. I just send a mail, we get a call, they said, yes, they are all in. So I think the flexibility, the agility, and that's what the vision of the founder is. So that's what, in my view, is the reason, not only of our existence, but also of our contribution. Thank you.
Thanks. Amit?
Yeah, I like the question. And I think that we are very cognizant that many organizations in the world do many good things. Let's just agree there are many. There's the Global Fund, there's Gavi, WHO, all these guys have a role to play. I'm also very cognizant that we should not duplicate. If we have too many duplications across many things in health, that's when we also have weaknesses and everybody. So I want to repeat what I said earlier, that one bucket is strategic partners, and I called them development partners or global health partners. That will be very critical for this platform to connect with. As the evolution goes through for GHCP, it may become an institution, it may become advisory, it may become a fund. We may even find ourselves calling it the Global Health Fund. And what happens with the Global Health Fund? It will help vulnerable and fragile countries to adopt digital technologies to improve health. There isn't such a fund existing. There isn't a single institution. So WHO and other organizations become strategic. It may also just happen that we may get folded as an activity under another institution, which is also fine. In the end, I think what the partners are looking for is results. I think we are agnostic about the structure, the model. Every council member who is on it wants to make the world a better place. If there is a more suitable structure and a more suitable model, and we accelerate the process, I think personally, I believe it's a good question, and it's evolution in process. We build our ship as we sail. That's what will happen.
I know we're running out of time, and Heather will give me another signal in a minute saying I've got a minute left. I just two things to say in addition to thanking you all. I was at the UN General Assembly last week in New York with a bunch of global leaders as well. And there were two things came out of that. Number one, as both speakers have said, these organizations like UN, WHO, etc., need to exist. If they did not exist, they'd have to be reinvented. The reality, however, is that they do not have an implementation network. You need to implement on the ground. We're doing that through our organizations and our ecosystem network. The last thing I'll leave you with is this, a quote that I discovered while I was suffering from jet lag in New York and watching boring American television. Pardon me to all the Americans watching, but it is pretty boring. And one of the quotes was, if you want to go fast, go alone. If you want to go far, go together. We have decided we're going together. And I'm really looking forward to the next number of years because I think we have only just started. So my thanks to all of you, my thanks to the team and the technical team for keeping us on board. And I'm sure you'll thank me for wrapping up now and letting you get on with the next session. So thanks very much indeed, all of you. Thank you.
Thank you.
Thank you very much for this session. Great to hear about the global initiatives and partnerships that go well beyond one country or one organization. Now it's a time for break, lunch break or coffee break, wherever you are in the world. So we invite you to take time and also visit our virtual booths to meet our partners, to get to know our projects, and of course, take the opportunity and network with your fellow 900, more than 900 participants from 95 countries. Thank you so much, and see you at 1:30 Central European Time, so in 30 minutes.